In terms of the pathophysiology, what we see in most patients that present with radiculopathy is a situation where a particular nerve is being compressed by most likely a herniated disc. Sometimes it can be a bone spur that developed over the years. As we age, we all develop signs of arthritis and degeneration of the cervical, lumbar, thoracic spine. And as that happens, there can be a mass effect and compression of defined nerves. And if that happens, some patients can develop these very specific signs or symptoms.
I'm actually very active. I have a 10-year-old son, and I coach his Pop Warner football team, I coach his lacrosse team, I help out with basketball, as well as some of my extracurricular activities. I go to the gym, and I'm a first-degree black belt in Taekwondo. We go to Montauk every year as a family vacation with 3 other couples, and this was pre-surgery. I love to go fishing. I love, water sports, and I was just not myself. I wasn't happy. Everybody noticed it. They're like, what's the matter with Steve? Why is he acting like that? We take our bikes up there. We go for a bike ride, and I was, I couldn't hunch over. I couldn't do anything. I was in so much pain. What
typically happens is that patients with back or neck pain who are diagnosed with a radiculopathy will typically try pain medication first. That can be just Tylenol or simple anti-inflammatory medication. And in 95% of patients, that is actually the treatment of choice that will lead to a very successful recovery.
I had a pain in between my shoulder blades. I had shooting pain coming down my arm when I would move my head to either side. And then I would get tingling and numbness in my 2 fingers here. And it was brutal. It was hard to sleep. It was hard to sit in one position for a long period of time, driving in a car, and it was bad. I had several compressed discs in my cervical spine, and there was, from the MRI that I brought to him, there was one significant disc that was more bulging than any other of the other ones that was causing the pain to radiate down my arm and down my fingers.
I think the most important feature is that we want to be able to correlate the patient's signs and symptoms to their neurological exam and then to their imaging studies. And that means that if a patient comes in with pain that is shooting down the right arm, for example, and weakness of the right arm, ideally we want to pursue a diagnostic workup that will allow us to image, in this case the cervical spine, because we're dealing with the upper extremity. And then the patients who are most successfully treated are the ones where we can actually see on the MRI scan what exactly is causing this particular nerve or the spinal cord to develop these symptoms.
I remember one specific instance. I came home from work one time, and we're all sitting at the dinner table, and I was in so much pain that I didn't even realize that I was having dinner, and tears started coming down my eyes.
Now we got an MRI scan of his cervical spine, and because the symptoms that he showed and the weakness indicated that there would most likely be a problem with one of the discs compressing the spinal nerves on the right side. And indeed, that's what we saw on the MRI scan. We saw a large herniated disc that was compressing the C7 nerve on the right side, and that completely explained his symptoms.
He asked me, did you try the physical therapy? Yes. Did you have the epidural steroid injections? Yes. He says, well, you're a perfect candidate for the disc replacement surgery. He gave me all the literature that I needed to do the research on, and we went home and thought about it. I talked to my family about it, and we decided to use Dr. Härtl.
A specific surgical procedure that we chose for Steve was a disc arthroplasty, which is basically an operation where we go in through the front of the neck. It's a microsurgical procedure. We do it under the microscope. It's a minimally invasive procedure. It's a short operation, only takes about an hour, hour and a half. And we went in, we found the disc that was pushed back and that was pushing on the nerve. Under the microscope, very careful, meticulous microsurgical technique, we removed the disc, we found the nerve, We found the spinal cord, and indeed we could see on the right side that there was a large herniated disc compressing the nerve. You can see that under the microscope very nicely. It can look very dramatic sometimes. So we were able to carefully remove that herniated disc and completely decompress the nerve, and then decided, based on his age, his particular interests, he's very sports-oriented, he's a very active person, we decided to offer him a disc arthroplasty, meaning that in order to fill the defect that we had created by removing the disc, we implanted a device that would allow over time to regain mobility and also to retain the mobility that the spine usually provides at that level. So we decided against the fusion in his case and in favor of a disc arthroplasty.
My experience at New-York-Presbyterian for my surgery was fantastic. I mean, from the time I came in dealing with Dr. Hartl's staff, they made me feel very, very comfortable. Not even like I was coming in to have a surgery. I mean, when I woke up in the recovery room after the procedure, I thought I was on vacation. I haven't skied in a year. I haven't practiced martial arts in a year. I'm looking to get back into doing those things. I haven't been able to go bicycle riding with my family, and I haven't been able to sleep. I could sleep again.
We always try to help our patients as much as we can, but especially in somebody like Steve, who is such a positive person and such an active person with a wonderful family, who was clearly significantly affected by this condition that he had. It is even more gratifying for me to kind of look back and talk to him, talk to his family, and also see him with his children and see that his life is really back on track.
Yeah, I mean, I'm pain-free. Whenever I come in and I check off the, what body parts are hurting, and 0 to 10 on the scale, I'm 0 now. I have no pain. I was in Boca 2 weeks ago swinging a golf club. I played 6 rounds of golf, not even a tweak. It's something else. It's amazing.